Thank you for joining us. This is KTM Mid Morning. My name is Koi. Cardiopulmonary resuscitation, popularly known as CPR, is a set of specific medical procedures designed to establish circulation and breathing in a patient who suffered an arrest of both. Now, CPR is a combination of chest compressions and rescue breathing. Now, if someone isn't circulating blood or breathing adequately, this first aid procedure can restore circulation of oxygen, rich blood that is, in the brain, because without oxygen, permanent brain damage or death can occur in less than 8 minutes. Anne Wali is a training and development officer at the St. John Ambulance, and she demonstrates and educates us on some basic first aid for airway and breathing related conditions. Stay tuned for that.
A major role in first aid treatment is reassuring the casualty, thereby gaining trust through the ability to confidently manage an accident, illness, or injury situation through effective and appropriate communication.
Casualty management is what you do to your person that has been suddenly taken ill or injured. Basically, in casualty management, we deal with the priorities of life, that is the airway, breathing, and circulation of this casualty. A casualty is a person who has suddenly been taken ill or has been injured following an accident. So before they are taken to hospital, we always term them as casualty. So as first aiders, we always deal with casualties since we are the first people on the scene.
Then pass the bandage down like this.
The ability to remain calm and in control is an important part of successfully managing a casualty situation.
The ABCs of first aid, what we look at is the airway. The airway passage consists of the mouth, the nose, down your trachea, down to the bronchi, to your lungs. So that is basically the things we look at when we look at the airway. So we look at the casualty's breathing as well. How is the casualty breathing? Is the breathing interfered with, or is it okay? And then we look at the circulation, where the blood also pumps, and we look at the pumping system of this casualty. With infants, we talk about children who are below 1 year old. With an infant who's choking, what you're going to see in the infant is a distressed face. The infant is going to be opening their mouth as if they want to remove the obstruction from the mouth. With the distress with the infant will also be crying. So you'll be able to tell that the infant is choking. So once you come to this infant, what you're supposed to do, since you cannot tell the infant to encourage the infant to cough, you need to hold the infant on your hand. Ensure you spread the legs of the infant on both sides of your arm. Hold the head to be lower. Ensure you do not block the airway. With the head lower, in between the shoulder blades, that's where you're going to hit. Use the heel of your arm to hit right there, or you can use your fingertips to hit there. So you're going to hit up to 5 times. 1, 2, 3, 4, 5. Turn the infant. Check the mouth to see if the obstruction has come to surface. If the obstruction is not to surface, measure between the nipples to the center. Then you're going to give chest thrust up to 5. 1, 2, 3, 4, 5. Check again. Measure. The nipples come to the center where your fingers meet. Use your 2 fingers to push, going down and up. So we're going to count 1, 2, 3, 4, 5. Before you turn the infant, confirm the obstruction has not come to surface. If the obstruction is still not there, we are going to repeat the sequence again. This is a cycle of 3. At the end of the 3 cycles, we expect that the obstruction will come out. In case the obstruction has not come out, what we'll expect with the infant is that the infant will go into unconsciousness. Then we are going to deal with unconscious infant. Choking is one of the conditions that can lead to a blocked airway. We have asthma as well, could obstruct the airway. We have near drowning cases, strangulation and hanging could also lead to a blocked airway as well. With a blocked airway, what you'd recognize in your casualty is that they're going to have difficulty in breathing. They could be gasping for air, especially with choking, universal recognition feature. You'll find most of the time you'll find that the child is holding their neck. They could be pointing at the neck. They could be having bulging eyes. With choking, they're going to have veins all over their face, so they have a congested face most of the time. They will be sweating, and you'll find that they have dripping of saliva as well. So the first thing you're going to do, always remember to introduce yourself to your casualty. Hello, are you choking? Can I help you? Please stand up. Try to cough. Try to cough again. Has it come out? Okay, let me offer support to you. Then you're going to give the back blows in between the shoulder blades, the same position we did for the infant. You're going to hit up to 5 times. 1, 2, 3, 4, 5. Has it come out? In case the obstruction does not come out, you're going to give abdominal thrust. What you're going to do, you're going to measure from the xiphoid, the sternum, and the umbilicus. In between the two, we are going to make a fist. So we're going to make a fist, place it right there. Interlock, then you're going to push inwards and upwards. At this point, your casualty can go into unconsciousness, so you need to offer better support. So you let your casualty spread their legs. Place your leg in between the legs of the casualty. Then you're going to force an artificial cough, push it in and up. So push in, up, 1, 2, 3, 4, 5. In case it has not come out, then you're going to repeat the cycle again. So you're going to give again the 5 back blows. 5 does not come out. Now the casualty spread their legs, then give the abdominal thrust again. 1, 2, 3, 4, 5. Has it come out? Not yet. You repeat the cycle again up to 3 times. Yeah? We hope by the end of the 3 cycles that the obstruction will come out. In case the obstruction does not come out, at the end of the 3 cycles, your casualty may go into unconsciousness. Then you're going to manage unconscious choking casualty. In case your casualty is a female casualty, like in our case, before you do the abdominal thrust, always remember to confirm that your casualty is not pregnant. In case your casualty is pregnant, do not give the abdominal thrust. What we give are the chest thrust. So this time our casualty is going to be pregnant. So you give the blows up to 5. 1, 2, 3, 4, 5. Are you pregnant? Yes. So our casualty is pregnant. So what you're going to do, you're going to give chest thrust. So in between the breast, you're going to place your fist there. Then you're going to interlock. Then you're going to push in. Let your casualty lean forward. Then you're going to push in, up, in, up, in, up, in, up to 5 times. With choking casualty, you should avoid giving water to this casualty. Most of the time, the first instant people do is giving water. Remember at this point, there's something blocking the airway, so swallowing saliva is already difficult, so it will be impossible to even drink water. So avoid giving water at that point. When you're giving your treatment to an infant, what we always avoid is to do a finger sweep of the mouth. Always ensure that you check the mouth in case the obstruction has come to surface. If you can pick it out, please pick it out. If not, avoid doing the finger sweep. With near drowning cases, these are casualties that you rescue from the water. So when you're rescuing your casualty from water, what you have to ensure is that your casualty, when you remove your casualty from water, they are facing up. Then ensure when you're lifting them, their head is lower. than the chest area. Then you place your casualty on an insulated place. Remember, this casualty at this point is very cold because of the water. Hypothermia will set in. So what you need to do is remove the clothing of the casualty. So remove all the wet clothing from the casualty. You could cover them with something warm. So you're going to open the airway, your palm to the forehead, 2 fingers to the chin. Open the airway. Check for breathing with your cheek to the face of the casualty. You're going to feel the warmth of the breathing for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Our casualty is not breathing, so you need to bring the breathing back. With the drowning cases, their lungs are compromised. So what you're going to do at this point, you're going to first give the 5 breaths. You're going to seal your mouth with the mouth with the mouth of the casualty. So pinch the nose, give the first ventilation. 1 ABC, 2 ABC, 3 ABC, 4 ABC, 5 ABC. And you're going to give the chest compressions. Interlock your hands with the heel of your hand at the center of the chest. Ensure your fingers are up. You lock your elbows. Bring your weight over the body of the casualty. Then you compress up to 30. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 30. Then go back and give 2 ventilations. 1 ABC, 2 ABC. Then give the 30 chest compressions. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 30. Continue with your CPR. Do not give up on your casualty. Continue until help arrive or your casualty recovers. So when you're giving your chest compressions or giving your ventilations, then you notice that the casualty is starting to vomit out or is having the gagging sound from the side, from the throat. Always turn the casualty to the side. Let the water flow out, then tilt back the head to normal position.
The recovery position helps a semi-conscious or unconscious person breathe and permits fluids to drain from the nose and throat so they are not choked.
In case you rescue your casualty and when you check for breathing, you find that your casualty is breathing, then you're going to turn our casualty into recovery position. So you're going to open the airway the same way. Check for breathing. So nearest hand to you, you're going to place it at 90 degrees. Farthest hand to you. Place it to the cheek. Scoop up the leg of the casualty. Then turn your casualty as you move back. You adjust the airway. Adjust the leg. So at this position, it's going to be easy for the body to eject the water, and the chances of the casualty choking are actually minimized. This is the best position if your casualty is breathing and they're in a near drowning situation. With the near drowning, what we should avoid is pumping out the water from the stomach. Normal body system, what it will do, it will resist extra water, so it will come automatically. The casualty will vomit it out. So the best thing to do is to turn the casualty into recovery position.
A blocked airway can kill someone in 3 to 4 minutes, but it can take minutes to hours for an ambulance to arrive. So a simple procedure such as opening someone's airway whilst waiting for emergency help to arrive.
Considering how easy it is to get certified in first aid, there's really no reason not to take some classes. When you know what to do in an emergency situation, you can become a valuable asset anywhere you go. The next time you are at a restaurant and someone begins choking, for instance, you'll know just what to do. Be someone's hero today. Get first aid training and learn how to be cool, calm, and collected, and a lifesaver basically in an emergency. Send us your comments on Mid-Morning at standardmedia.co.ke, or better yet, check out our Facebook page, KTM Mid-Morning. Drop in a comment and don't forget to like the page. That's all we do have for you today. Enjoy the rest of your day.